Hello and welcome to Healthy Living, brought to you by St. Tammany Health System. I'm your host, Melissa Hodgson, and we're excited to be back in the Studio A of St. Tammany Parish Government. We've been gone from here for quite a while because of the worldwide pandemic and COVID-19 and its impact on our local community. Community health is our focus today at our first episode back on Healthy Living. We'll be talking about a community advisory council focused on a healthier North Shore. We'll speak first with Pablovich. Ann leads the organization, the council, and we will speak with Dr. Michael Hill, who is St. Tammany Health System's foremost authority on public health and population health. And then we will talk with Nick Richard, who heads up NAMI St. Tammany, and that mental health component is so important to community health and wellness. So we'll start with Ann Pablovich. Ann, thank you so much for joining us.
Thank you for having me.
We're excited to be here. We've got our masks. Absolutely. We've got our 6 feet of social distance. We've had our temperature checked. We're doing everything right. And yay, we get to be out here like humans talking to each other.
Absolutely.
Thank you for being here. So let's start just with, talk to me about this community health initiative.
Yeah, so I just started with the health system earlier this year, and it is kind of a new priority, a new focus for St. Tammany Health System and getting out into the community. The purpose of this advisory council is to kind of guide the initiatives that we're hoping to implement. We want to make a change in how our community is rated in terms of our health status and in terms of the chronic diseases that we have, that we battle. And so there's a few things that we're hoping to implement. We've had our first advisory council meeting earlier last month and in September. And so, yeah, we're excited to kick it off.
Okay. So I hear you saying, you've seen Louisiana at 49th and 50th. We're excited that, we've at least made it to 44, so a little progress there.
Absolutely.
And of course, St. Tammany and Washington parishes being the healthiest and the least healthy in our entire state.
Absolutely.
And so what we want to try to do is gather some folks together. So who are the people? Tell me who's on this committee.
So the council is comprised of community stakeholders and leaders across St. Tammany and Washington parishes. So we've got our healthcare leadership involved. We have our elected officials that are involved, and then a number of nonprofits that really are integral in community health initiatives and what their focuses are primarily on.
So you have people from St. Tammany Health System, from Oxnard, North
Absolutely.
Shore, and then certainly elected officials, and then civic organizations too, like the Business Council, the Chamber.
Absolutely. The North Shore Community Foundation, NAMI, as you know, Nick Richard's going to be here. He's on the council. The food bank, different organizations that have some component that can contribute to improving health in our community.
Great. And then of course representation from not just elected government but also government offices like the Louisiana Department of Health Region 9.
Absolutely.
Wonderful. Okay, so we know that the initiative is looking at St. Tammany and Washington. We know a little bit about the kinds of folks who are on it. Tell us a little bit about what your primary focus is or what it is that the initiative is hoping to do.
Sure. So we know, not just St. Tammany, but Louisiana struggles in our response to a number of chronic diseases. Cancer and heart disease are really problematic for our community. And there's a number of factors that contribute to that: obesity, lack of activity. We don't have a huge active community, and then smoking and alcohol use are really heavy contributors to most chronic diseases. And so this initiative is really, there's 3 primary focuses, and that's education, early detection and prevention, and then connection to resources. And so by pulling together all of these leaders and stakeholders in our community, we're hoping that they can help us address how we can tackle some of these challenges. They can give us different perspectives and things that maybe we haven't considered as a health system. A different perspective can sometimes help bring awareness to another challenge that's associated with this problem. And so, so those are the 3 primary components: is education, early detection and prevention, and then connection to resources.
Great. Education, early detection, and connection with resources.
Yeah.
I love it because we're out there educating the public about things that they can do to keep themselves healthy,
Absolutely.
take care of themselves, and then early detection, of course, we know that the way to good health is to find things early, take care of them before they become serious.
Absolutely.
And then connection with resources, absolutely such an important factor. When we think about folks who are underserved, maybe live far from care or don't have insurance or don't know what their insurance may or may not cover.
It's a struggle. One such collaboration that is already underway is a partnership with the Cancer Center and this North Shore Food Bank, where they provide food boxes to some of our oncology patients. And so, when you're in the midst of treatment from a diagnosis of whatever sort, sometimes it can be hard to pay for that treatment, pay for your deductibles, your co-pays, and then also put food on the table for your family. So having partnerships with these community-based organizations, we've got a huge support in our community from all of these organizations, but tying them together and making known, when there's a struggle or when there's an issue that somebody needs help with, we're all going to be better for it in the end.
That's an outstanding example of your connection to resources. The third one that you mentioned, that North Shore Food Bank has a pantry in St. Tammany Cancer Center.
Yeah.
That's just beautiful.
Absolutely.
The middle one that you mentioned, early detection, you have some really neat ways that you're doing early detection. There's a comprehensive screening opportunity.
Yeah,
Can you talk about that?
Sure.
One?
So we have one of the things that we've started to develop is a education and screening program called Health Check 365. And one of the events that we've done, we've had 2 sessions so far, and it's a comprehensive health screening. Just as you said, it covers 10 screenings, from skin cancer screening, head and neck cancer screening, a lung cancer screening through low-dose CT. You go through the gamut to having cholesterol labs done, and so it's a cash pay price. So it doesn't matter if you have insurance. It doesn't matter if you have a primary care physician. You can participate in this event, and it's been really helpful. It's a consolidated event, so you get 10 screenings in about an hour and a half. It's very efficient, so you're not spending a lot of time waiting in doctors' offices or waiting, to have these procedures or screenings done. And so it's been a great success so far. We're trying to do them every 2 months. And so it's geared to the busy working parent that doesn't have a lot of time to take out of their day to tend to their health.
And kind of get everything checked out and
you get
follow up what needs to be followed up and feel confident about everything that came back happy.
Absolutely.
That's wonderful. And then education, of course, we're out in the community all the time with that. Can you talk to me a little bit about why St. Tammany Health System and Ochsner, why hospitals take care of the sick?
Yeah.
So talk to me a little bit about why we want to involve members of the community and really sort of steer this good health initiative.
Yeah. So you mentioned earlier, prevention is key. If people know better, then they can do better. If you know that having a healthy diet and exercising could prevent you from getting a specific type of cancer, then you might make it a bigger priority. It might be less about looking good and more about taking care of yourself. 90% of what we as a nation spend on healthcare, I think it's $3.5 trillion in the last year, is focused on chronic disease, and so in the treatment of that. And so if we can prevent some of that from happening, then we're going to have
a healthier community overall.
Healthier individuals. Yeah, it's going to be a win for everyone.
That really is neat, because the next person we're going to speak with is Dr. Michael Hill, and he's going to talk to us about population health. And so it's really exciting to see these 2 health organizations coalescing and gathering around the community and developing this community advisory council.
It's exciting.
Healthier North Shore. I'm so excited. We'll sit around talking about our Healthier North Shore a year from now.
I hope so.
And thank you so much for coming in.
Thank you for
We're
having
excited
me.
to be talking about this.
Yes, ma'am. Thank you.
Up next, we'll be talking with Dr. Michael Hill from St. Tammany Health System about the population health component of our Healthier North Shore. We'll be right back.
Hello, my name is Joan Kaufman and I am privileged to serve as President and CEO here at St. Tammany Health System. It's hard to believe it's been already 6 years this month since St. Tammany Health System and Ochsner Health came together in a collaboration of equals to provide the improved access and quality of care to our area residents. And when I say improved access, together we actually have 40 primary care providers to serve the needs of the community. One of the other aims was to enhance our specialty care, and together we have created tremendous access to additional specialists, whether it's neurosciences, orthopedics, pediatrics, and other areas that we've been able to partner together to deliver on that aim. And then finally, we are working together to make care affordable. And speaking of affordable, St. Tammany Health System was recently recognized by Blue Cross Blue Shield of Louisiana as a center of distinction for knee and hip replacements. What a tremendous honor that is, because quite honestly, it delivers on those aims that I mentioned earlier. Enhanced quality of care, improved access, and certainly greater outcomes, making care affordable. I want to take the opportunity to remind everyone to get your flu shot. Be proactive in doing so that you can stay healthy and stay strong throughout the winter months. Thank you so much, and as always, please visit us at www.stph.org or follow us on social media. Thank you so much, and have a great day. God bless.
Welcome back to Healthy Living, brought to you by St. Tammany Health System. I'm your host, Melissa Hodgson, and we're talking today about a community advisory council focused on a healthier North Shore. We talked first with Ann Pablovich, who is heading up the council, and we will speak with two other members of the council. Next is Dr. Michael Hill, who works with St. Tammany Health System in the executive team. His focus is on population health, quality, and utilization management. Dr. Hill, welcome. We're so glad you could join us.
Thank you, Melissa. It's great to be here.
It is, isn't it? Back in the studio in person.
Yes, it is.
We're doing our part with our masks and
Right.
social distance. We're talking today about the advisory council that is focused on healthier North Shore. And I know I talked a little bit in the first segment of the show about how people think of hospitals as where to go when you're sick, but we really have a duty and a responsibility in our community. We say we're the heartbeat of our community, and we really mean that. So can you talk a little bit about the challenges our community faces in terms of chronic disease and just general health status?
Sure. So, as you said, we've been used to treating people when they get sick, and I think St. Tammany Health System really is being proactive and starting to work with our population and our patients in on prevention. Like Ann said, we spend way too much on health care in our country, and a lot of it is because we're reacting to things that are happening now. And what we want to start doing is focusing on managing chronic diseases and things that set people up for poor outcomes later in life. So the earlier we can get to folks, and the earlier we can do screenings, and the earlier we can do preventive things with lifestyle changes such as exercise and diet and those sorts of things, and good eating habits and reduction in alcohol consumption and doing away with smoking, we'll have better outcomes both in chronic conditions and in cancer. You know, our leading cause of death in our two parishes, Washington Parish and St. Tammany, are heart disease and cancer, and those are directly affected by those variables we just talked about.
Right, and I think heart disease, a perfect example, we can look at Washington Parish and St. Tammany Parish and see a significant amount of heart disease. And then, as you said, cancer. We have a wonderful coalition of cancer professionals in St. Tammany Cancer Center, and we know that our partner Ochsner Health and St. Tammany Health System are building a whole new building, but that aspect of it has a lot to do with the care once someone has a diagnosis.
Right.
So if we can reach out into the community, if we can go do some early screenings. So for example, we know that breast cancer, when found early, is very much a survivable experience. And lung cancer, which is one of the diseases that often isn't found early, we have a special program for that.
Right, we do. We have A few things I want to say, because you brought up some really important points. One of the things that we found is too often here in our parish, in Washington Parish, we have people who are diagnosed too late. The earlier you can get diagnosed with a cancer, usually in most cases, the better the outcome. And too often people are waiting too late to get screened. And that's why screening is so important. And not just screening once, but routine screening either every other year. For colorectal screening, it's a colonoscopy every 10 years, unless you have certain conditions, and then it's more often. You mentioned mammography, very important, screening for breast cancer. We have low radiation CT for screening for lung cancer in patients that are at risk. And these are all important things to detect changes early so that we can treat early and have better outcomes. As I said, too often we're getting people in the later stages of cancer, and it's much harder to treat those patients and to have good outcomes.
Okay, thank you for that. And you know, that all of that focus is very much on being proactive, getting that screening, going to the screening or having the screening come to you. Mm-hmm. But a lot of folks, I think we have a tendency to be a little bit of, if it ain't broke, don't fix it. If I don't go to the doctor, nothing could be wrong with me, I'm not hurting. But almost all of us with an insurance plan probably have some sort of a wellness component, and I bet a lot of us aren't using that.
Right, and every plan varies, but a lot of plans have very low deductible payments or no payment for wellness visits or for screening. And so the other area is heart disease, which is affected by hypertension and diabetes and obesity, and those are things that we can change. If we can change early in life, we can prevent those early cardiac deaths that we see, you know, in our community. So it really is a lifestyle change. We know that if you affect some of these things early in lifestyle and do your annual screenings and see your physician or provider early and often, at least once a year, we're going to have better outcomes. And our goal really is, believe it or not, is to keep people out of the hospital, to have a healthy community, to move Louisiana up in the standings in both decrease cancer deaths and heart-related deaths.
Wonderful. Well, and you know, it's interesting, we're sitting here talking about these long-term chronic diseases that our North Shore community has dealt with forever: heart disease, diabetes, cancer, but we have a brand new one we're having to deal with now, a worldwide pandemic, COVID-19, and it is right here on the North Shore. Can you talk to us a little bit about how that's affecting our population?
Sure. I think we saw early on that when we had some increased cases, that people were nervous about going to the doctor or going to the hospital, even if they had symptoms. And we had some significant cases of people that delayed care to their detriment. We've had a couple of cases of people with heart attacks that they had at home and waited several days to come into the hospital, and that really causes a lot of damage to the heart and a poorer outcome for those patients. So we really want to encourage people to, number one, continue to meet with their providers, whether it's in a virtual visit if they don't feel comfortable going to the office, or coming into the office for a face-to-face visit. I can say that we take very good care at St. Tammany Health, and I know Oxford Health does the same thing in having patients come in. They can wait in their car and come in straight to the visit. They can also do a virtual visit if they don't feel comfortable coming into the office. And if they have an acute symptom, come to the hospital. It's safe. The big message is our emergency room is safe. We take very good precautions. The hospital probably is one of the safest places you can go now, and there is really zero risk of catching COVID going into the emergency room if you wear a mask, if you do social distancing and do good hand washing. And we do all those things at St. Tammany Health System, and Oxford Health does the same thing. So we feel very comfortable about having patients come into our healthcare facilities or our clinics.
Fantastic. And would you say, I think, what you're talking about is what we're experiencing today as people are sort of weighing how they feel about COVID and what their comfort level is, because it is here and it's been here for 6 months. Would you say that some of what we're experiencing with the human reaction to COVID has to do with all of our comorbid conditions?
Sure, and we've seen poorer outcomes in Louisiana because of the health conditions of our patients. We know that patients who are obese have a higher mortality rate with COVID. Patients who have heart disease or lung disease may have more difficulty when a respiratory component comes in with COVID-19. So certainly underlying health condition really does kind of portend to an outcome in patients who have serious effects from COVID-19.
Got it. Well then, what would you say we should all be doing to protect ourselves from COVID? Wear a mask.
Wear a mask. Socially distance if possible. No large crowds. So, I mean, really and truly, when we've seen super spreader events, it's large crowds getting together. It only takes one person in that crowd to be infected, and we know that about 1/3 of patients with COVID are asymptomatic and will shed virus. And the other thing is good hand washing. So, soap and water, preferable for 20 seconds. If you don't have water, hand sanitizer when you can. And I think, again, continue to work on your health. Don't neglect your health. Don't neglect your mental health during this time. So I think it's important to do those things.
Well, thank you for that. And actually, mental health, Nick Richard is going to be talking with us next about that component. So thank you for that.
Wonderful.
Really appreciate you coming in, Dr. Hill.
Well, thank you, Melissa. Good to be here.
You're watching Healthy Living, brought to you by St. Tammany Health System, and we are talking today about a healthier North Shore and a community initiative to try to make a difference in the population health of St. Tammany and Washington parishes. We've talked with Ann Pablovich and with Dr. Michael Hill, and up next we'll speak with Nick Richard from NAMI St. Tammany. We'll be right back.
Hi, I'm Leslie Kelt. I'm Director of Infection Prevention for St. Tammany Health System. I'm here to talk about social responsibility out in our community. We're out doing things like running errands and being with other people, but there's still 3 things that we have to do consistently even as we get into our cars. First and foremost, remember, never go out in the community if you're sick. If you're sick, stay home, contact your doctor, either get tested or know what you have to do. Secondly, when you're out, we always want to do hand hygiene. If you're home, you have soap and water, but in your car, you should always have some hand hygiene product, either with you or in your bag with your mask. So first and foremost, before we put our mask on, we're going to put some hand sanitizer on, and we're going to make sure that we get that all over and nice and get it till it's dry. Now we're going to put our mask on. To put our mask on, in our car we should have a bag, something like this, where we keep our mask. If you have more than one person traveling, please have a bag for each person. I'm going to take out my social mask, and this mask is a homemade mask, and it is made with a product that can be washed. This one has copper and silver in it. We put it on our nose, we don't pull in front, and we make sure we're all good to go. Now we're safe for ourselves as well as the community. Now once we get back into the car, we're going to make sure, and guess what, I do keep hand sanitizer with me, even in my purse or on the bag. Before I take it off, I'm going to make sure I do this once again. Make sure I get some hand sanitizer. I'm going to pull it off and put it back in. I'm going to get my baggie out, and I'm going to make sure I put it in the baggie, and we're going to make sure that we wash this. You should have at least more than one, and you should be washing them at least once a day. Have one available for the next day in case you forget it at home. Sure. Now just remember 3 things. Stay home if you're sick, do hand hygiene, outside in the public, keep yourself some hand sanitizer, and also always wear a mask when you're leaving your car or you're going to be within 6 feet of people. Thank you. Be responsible, be safe, and always remember St. Tammany Health System.
Welcome back to Healthy Living, brought to you by St. Tammany Health System. We're talking today about a community advisory council focused on a healthier Louisiana in Washington and St. Tammany parishes. We spoke with Ann Pablovich about the council and how we are coalescing health, civic, and government organizations together to focus on health and wellness. We spoke with Dr. Michael Hill about the population health component. And last, we're going to take a look at the mental health component, talking with Nick Richard of NAMI St. Tammany. Nick, thanks so much for joining us.
Thanks for having me.
Really excited to have you here for a number of reasons. One, it's just nice to be around humans as we're crawling out of our isolation and COVID.
As social creatures, we do need other human beings, yes.
We do. It's good for our mental health, as a matter of fact. And as this Community Advisory Council is looking at population health and looking at how to move Louisiana up that ranking of healthy populations, there's a lot of talk about chronic disease, about heart disease, diabetes. We're talking about COVID. Those are all aspects of our physical makeup, cancer, early detection. All of those things are looking at our heart, our lungs, our bodies, our organs. But aside from the organ, the brain, the mind, that magic that is the difference between the science and the emotion, that's a huge piece of our health. And so can you talk a little bit about how mental health is such an important component of this advisory council?
Well, you can't really have proper physical health without proper mental health, right? You know, it just as, if you're not doing well psychologically, you're less likely to live a healthy lifestyle. So you can't ask an individual with, for example, if an individual has major depressive disorder, they're more than likely not going to be doing the exercise, the dieting, all the other things going to their doctor that they would need to do if it's untreated. If it's treated, then individuals tend to live a little healthier. But look at this as well. Depression is the leading disability worldwide.
Wow. I
mean, that is a statistic that is not often put out there. And again, that's from the World Health Organization. Mental illness, untreated mental illness, it costs the United States alone billions of dollars, not only from individuals, from going through the mental health system, the medical system, the jails, but also from their caregivers, right? Missing work, dealing with crises. Our statistic in our field is 1 in 5. So 1 in 5 individuals in their lifetime will develop a mental health condition. But when you factor in that those individuals not only have husbands and wives and children, you really look at this it's a full community impact. It's 5 in 5. 5 in 5 people will be impacted by mental illness in our community. It's so yes, I think of all of the healthcare agencies or industries, we've probably been the furthest behind. It's a little harder to distinguish. You can't just take a blood test and say, hey, well, this person has this. But with proper treatment and access to services, the good thing is you can live successfully with the mental illness. So it is the type of chronic illness where you can have a pretty successful life.
Absolutely. And I think you're getting at an interesting connection between our physical health and our mental health. When we were talking with Dr. Hill about our population and what some of our worst chronic conditions are, when you look at heart disease and you look at diabetes and you look at obesity, there are many times mental health roots to those or components to their being perpetuated.
Right. Well, you also got to look at it. If you get diagnosed with cancer, you're not going to be having a great day, right? And there's more and more research that's shown, and I was talking to Dr. Hill about this, there's more and more research that's showing that not only, obviously, your mental health is impacted when you have these diagnoses, but when you're in treatment, if you're taking care of your mental health, your outcomes are going to be better. Every chronic disease, if we're able to take care of our mental health, we're noticing that people are getting better faster. So it's directly tied to, the brain is one of the most essential organs in our body. It's just that we don't have, certain tests. It's just not as easy to distinguish between it. But I also want to put out there, the issue in mental health, again, it's not always access to treatment. We have that issue, just like, it was spoken about earlier. But when you look at the statistics, less than 40% of Louisianians who have a mental illness receive treatment in the year before they were surveyed. So we have less than 40% of people with mental illness receiving treatment. And then we start looking into the why, right? Is it access? Sometimes. In St. Tammany, we have adequate practitioners. We could maybe use some other services. But quite often, it's stigma and it's the understanding of what we're looking at and where do we go.
Well, tell me what you mean by that. So what we're looking at and where we go.
Sure. So, again, if somebody's exhibiting signs and symptoms of mental illness, not everybody's fully educated to know that that's what it is, right? Sometimes those signs, those symptoms, let's use children for example, right? So given that we've had all these restrictions with COVID, we've restricted our youth's access to their peers, especially in teenagers, we're noticing, and we're going to notice this for some time, we're noticing that you're going to see more behavioral issues, right? Yeah. Sometimes people are going to attribute that to a kid just being a bad kid, right? It's not always that. It's the same thing with an individual. Maybe someone's dealing with chronic depression, and you're saying, well, they won't exercise, they won't eat right, they're lazy. It has nothing to do with it. It has to do with their brain and the chemicals that are being produced and the help that they need. So, that's what I'm referencing. Sorry.
Okay. Well, that makes so much sense. I think, we as a culture have a tendency to say, oh, suck it up and get over yourself and get out there and just get on. And I think that's, we don't say that to someone who has a cancer diagnosis. Right. We don't say that to someone who has a heart attack. We need to recognize that a mental health crisis is also a disease, and it is a condition that someone needs support and medical intervention, although that's usually a combination, of course, psychology and psychiatry.
Right. Well, I think it's just like any other chronic disease. If an individual, and again, I'm not a doctor, but if an individual gets you go into your doc and you have high blood pressure, right? Typically, I would imagine that you're going to try and deal with that by way of diet and exercise. And if that doesn't work, then eventually there's other interventions that lead to medication. Mental health is no different. Just because you have a mental health condition doesn't necessarily mean you have to take medication, doesn't necessarily mean you have to have therapy. Like any chronic condition, you may need a combination of those things, but also like any chronic condition, the earlier you intervene, the better your outcomes will be. So the statistics tell us what we know about mental health is by the age of 14, 50% of people who have a lifetime mental illness are showing signs and symptoms, and by the age of 24, 75% are showing signs and symptoms. The problem is the average time between the onset of mental illness and the actual treatment is 11 years on average. There's no other chronic disease that exists where you will have an 11-year gap between showing signs and symptoms and actually receiving treatment. So I don't mean to oversimplify it, but in the mental health world, the answers are actually quite simple. We just need to get people in the door sooner, and I think that's the case with most chronic health. And again, we've used many different strategies in the mental health world. It has to do, obviously, with education. Education is one of the biggest things that we can do as a community and as a society, is educating people not only to the signs and symptoms, but also that, it's okay not to be okay. It's all right. We can get you help. We can get you where you need to be. It's not something you need to be embarrassed about. It's not something you need to be shameful of. And when we can remove that stigma and that shame, we can help people live in a healthier community.
Absolutely. And so I think this fits so beautifully into that Community Advisory Council and its aims of education, early detection, and connection with resources, because our mental health is just like our physical health. If we can educate the public, if we can detect it early, and then connect people with the resources that they need, then we wind up with a healthier population overall.
Yeah, it's funny because I'm so focused on mental health, and I didn't really think about applying those same principles until I've gotten engaged in this and really just looking at the principles. They can be applied just as easily to all of our primary healthcare issues. So I'm happy to be a part of this, and hopefully we can bring the experiences that we've learned in decreasing stigma and educating people in the community with mental illness.
Outstanding. I think that the mental health industry has something to teach those of us in the physical health industry, especially because so much of the work that you do is outreach in the community. And we as a community health system and our partner Ochsner Health and as a not-for-profit for Louisiana and Mississippi Health and Wellness, I think we're all focused on how to create this healthy population for everyone to improve their quality of life and their overall health and wellness, and that has to do with the connection between mind and body.
Well, it's all connected. Again, if I don't feel that I have value, I'm not going to take care of myself, right? If I don't feel that I can get outside of my own head or even outside of my own house, or if I don't feel a connection to my community because I've been ostracized or because I'm dealing with untreated mental illness, I'm not going to put the time into taking care of myself because I don't feel like I have that value. So again, when we're dealing with especially depression, giving their brain, individuals with depression, quite often their brain's telling them that they don't have this value, that they're not worth that. And when we can get people into treatment and get them the help and the support that they need, which is relatively inexpensive in the grand scheme of chronic illnesses, then they're going to end up taking care of themselves as well, and they're going to be healthier people all the way around.
Brilliant. Well, Nick, I so much appreciate you coming in today to talk about the mental health component of overall health for our population.
I thank you for having me. I mean, this has been, as a mental health advocate, it is energizing to see our community come together and talk about a topic that for so long we haven't talked about. We haven't really even recognized that it was so much of an issue. So for all these leaders, in our healthcare community to come together and to even put a spotlight on mental health and its connection to the communities, it inspires me.
Well, thank you. You've been watching Healthy Living, brought to you by St. Tammany Health System. I'm your host, Melissa Hodgson. We talked today about a community advisory council focused on a healthier North Shore. We hope you'll join us next month for another episode of Healthy Living.